I took it extra.
Okay, let's keep it now. We can give it.
Yes, ma'am.
Thank you.
आप कहते हो विकास परेशान बहुत करता है
नहीं, आप मेरा कितना काम करते हो. Thank you, विकास.
Thank you.
अंकित डॉक्टर हरीश से बात हो गई है तो he will be there. And what time you will start with the video?
I think we should go live by 3:55. So we have 10 minutes video. So by 4:05 that will be over, and then we can, you know.
Right. Perfect. You have shared all the profile slides you have with you?
Yeah, I have with me.
Achha, achha, and with Shankar sir also you have shared?
Hi, Ankit. Hello, sir. How are you?
How are you? Kaisi hain?
All well.
It's live. We are sitting in the clinic, I think, in the Max clinic.
Yes. No, I'm sitting at Dabur, the other place that I.
Oh, okay. That is also. So it's like a clinic or what? Like it is.
It's a functional medicine center.
Okay. So you see patients, or it is only the research and
all forms of patients, from terminal cancers to all cardiometabolic conditions.
And where is it? It is in the same Dabur corporate office? Or?
This is Sector 48, Gurgaon. It's a standalone clinic center.
Okay. It's a standalone.
Yeah. But our medical director is Dr. Alok Chopra, who is the director of Fortis Ashlok. I don't know if you have heard of Dr. Alok and Dr. Ashwini.
Yeah. So he's the medical director. Okay. Dr. Ashwini Chopra was the owner of Ashlok Hospital.
Yeah, they are both twins. They are owners of that hospital, Dr. Alok and Dr. Ashwini. They are twins.
So this is jointly they have set up with Dabur? Something like
that? With Dabur, and there is one more investor, Mr. Sanjay Sariva, who's the CEO.
Yes, sir.
Hi, Ritika.
4:30.
Hi, Ritika.
So आप 4:10 पे आ जाइए सर, 4:40 पे निकल जाइए.
Hi.
UPL 5 o'clock आ रहा है. ठीक.
Hi.
Okay. Hi, Ritika. How are you?
How was the nutrition celebration in the morning?
Just back from there. So we were in the auditorium all this while. So just back from there.
Okay. Some conference going on or something?
No, it's a part of our this thing. We have a National Nutrition Week celebration going on. So we had our top management people in the hospital. So it was a small program for the girls. Yeah.
So how is the new management and the rebranding and
completely changed? Yeah. So we have a new look and a new brand and everything. Even the work pattern and all, everything has changed.
No, I saw that video of this Mr.
Mr. Soy, and the brand, the new logo which is being.
The new logo which you have. Right.
So we have now Mr. Mridul Kaushik. He was also Dr. Mridul Kaushik is the new CEO. So he was also here today for a program. So he's from BLK, but he's now become the CEO of Max Healthcare now.
So these guys are there, like Anas Wajid was there in marketing.
Mr. Anas is still there with the marketing. Rest, all the people, the other people in the management have all moved out. Yeah, Anas is still there.
Anas is there. And who is overall marketing head?
Anas is the head.
Anas is there. Mr. Shankar is also there. Yeah.
Good afternoon, Shankar sir. How are you?
Good afternoon. How are you?
I'm very
good to see you again.
Good to see you again, Shankar sir. Good to see you again.
Okay, so we are live right now. So before we start with the session, I'll start with a small video about 150 days of work in the COVID times. So I'll just play the video and then I'll introduce our panel for the day, and then from there, Ms. Manjari and Shankar sir can take over.
Yeah.
So I'll start with the video right now.
And Dr. Harit just called up. He said he'll come by around 5:05 or 4:10, and he will leave in half an hour by 4:40. He said if he can leave. So I think beyond that, if you can continue with the nutrition part, Dr. Manji. So and 5 o'clock UP Health Minister will join. So we'll do a 15-minute session with him in the end. He will join. Yeah? Okay.
I think I can leave by then Manjari, by 5.
By 5 you can leave.
Yeah.
Yeah, but 4:40 to 5 when Dr. Harit is not there, it can be pure focus on nutrition. Yeah. Okay, we can start the video and start.
नहीं यार
हम लोगों को चेंज हो गया तो दोबारा तो ठीक है सर कोई पेशेंट आए थे मैंने बोला था कि आप बैठे हैं
Myself, Dr. Pradeep Srivastav. I am a public health expert. I represent the HEAL Foundation, a healthcare advocacy group in India. And today's objective is I wanted to introduce to you a very unique program called Heal Die Samvad. You can even call it Healthy Samvad or Heal Die Samvad, which is being introduced by us, brought to on our platform by HEAL Foundation in association with an international public health program.
So Dr. Harit is also there, sir. We are just playing a small video and then we'll start the program, sir.
Sure.
ICCIDP.
So video view कैसे करें? View कैसे करें? Video view कैसे करें? Video view.
बात के लिए मैं आप लोगों को धन्यवाद देता हूँ हिल फाउंडेशन की टीम में. The speakers that you brought तारे आसमान से जमीन पे ले आए आप सारे सितारे थे. Excellent panel of speakers. Excellent. Best you can think of. My concluding message would be number one, that the entire world is your family, as our ancient scriptures have said. Vasudeva Kutumbakam. Why? Because this virus does not discriminate between any color, caste, creed, country, age or gender. हम सब एक लोग हैं, एक कुटुंब है हमारा. So we have to face this pandemic with a human face, expressing sympathy, empathy and compassion.
संकट काल में पेंडेमिक के इस काल में कि जब पूरी धरती पर भय, असुरक्षा और एक प्रकार का अवसाद है, ऐसे काल में आपने एक संवाद का अवसर दिया है. हमारे शास्त्र कहते हैं कि वादे वादे जायते तत्वबोध. जब कभी व्यथा हो, अवसाद हो, चिंता हो, अल्पता और विशेषकर कोई रोग हो या मानसिक क्लेश हो या किसी भी प्रकार की मनुष्य के सामने चुनौती हो, तब वो संवाद करें.
Sometimes it can be a relief also that you don't have to get up and wear your best clothes and be out and about. That can also be relaxing for the first couple of days where you can just be. But after some time, I do feel when such an extended lockdown happens, in order for you to feel a little boost of your own self-esteem, for you to do something in the day, there's nothing wrong in wearing clothes that you would go out in, putting on a little makeup, doing your hair.
Heal Foundation has been doing considerable work. It's about 10 years old now. And we have been organizing a lot of health writers workshop, and main focus is on training health writers to report accurately on health issues and current health issues, and not be carried away by sensationalizing things as many of the previous do, especially after the onset.
Hi, good afternoon, everybody. Welcome to another episode of Health Samvad. I will start with the introduction of today's panel. The topic that we are taking today is impact of COVID-19 on cancer care and nutritional management of cancer, current science. So our speaker for the day are Dr. Hari Chaturvedi. He is chairman of Max Institute of Cancer Care. Dr. Hari Chaturvedi started his oncology career at the esteemed and well-known Cancer Institute, Adyar, Chennai. Dr. Chaturvedi has performed surgeries at live surgical workshops and has been championing the cause for cancer awareness and been a crusader against tobacco for the last 15 years through various cancer foundations. He is widely respected for his clinical and surgical skills. Dr. Chaturvedi leads the oncology team at Max Healthcare consisting of 80 oncologists spread across 7 major super specialty centers and other standalone centers across Delhi NCR and North India. He is the past president of the Indian Association of Surgical Oncologists and Indian Society of Oncology. Then we have with us Ms. Ritika Samadar. She is Regional Head South Zone Max Super Specialty Hospital Saket. Ms. Ritika Samadar is Regional Head South Zone Max Super Specialty Hospital Saket in the field of nutrition. She has over 25 years of experience. She is a trained bariatric nutritionist from Herman Memorial Hospital, Houston, USA, and certified sports nutritionist from Internal Sports Science Association, California, USA. He is an advisory board member of Suposhan, a step toward improving nutritional status of East Delhi Municipal Corporation school children in Delhi. Suposhan, a joint initiative of East Delhi Municipal Corporation, Heal Foundation, and Britannia Nutrition Foundation. She is also an advisory board member to Nutrition Quotient online certification program of food safety, packaging and nutrition, FSCI, SNF at hospitals. Ms. Manjri Chandra, consultant nutrition. Ms. Manjri Chandra's passion for nutrition science and her versatility has enabled her to accomplish new heights in the field of health and nutrition. Having served as clinical nutritionist and diet consultant for over 20 years in some of the top hospitals of India, Manjri has expanded the horizon of her expertise from hospitals to the corporate health sector. Qualified in hospital administration, Manjri has master's degree in therapeutic nutrition and clinical dietetics. She is also a certified sports nutritionist, diabetic consultant, educator, and weight management specialist. She is a regular writer in prominent magazines such as QI, The Week, HT, Health and Nutrition, India Express, Outlook, and many more. She is also a regular health expert on primetime television shows on India Today, NDTV, Mirror Now, CNN, News 18, and Z News. And we have with us Dr. Swadeep Srivastava. He has over 25 years of experience in the healthcare communication industry. He has his finger on the pulse of Indian healthcare industry, considered bringing health media to the forefront in the media industry as one of the key highlights of his career. In his endeavor to make health a priority for Indians and help stalwarts of the healthcare industry to take their message to the masses, he created and successfully executed various disease awareness campaigns under Heal Foundation's banner. He has set up in Asia's largest health writers capacity building program under the banner Heal, instrumental capacity building of health writers across India. His latest endeavor, India Virtual Hospital and Ayurved Senior Care, provides healthcare delivery solution to all sectors of the society, especially elders, with support of experienced workers. We have Mr. R. Shankar. He is the president of Heal Foundation, has more than 30 years of experience in the field of journalism, also has organized over 50 health writer workshops and 7 national and health writers and editors convention in the past 10 years. He was formerly associated with New Indian Express as resident editor South and later on took over the editor for MSN.com. Currently, he is the chairman of organizing committee of the Heal Foundation, health writers and editor convention and consultant with many media houses. With this, I'll hand it over to Manjari, who is our moderator for this session, and Shankar sir, who will be co-moderating with her. Over to you, Manjari. You have to unmute yourself.
Thank you, Dr. Ankit, and thank you for the introduction to all the speakers. Good afternoon, Dr. Harith. Hello, Dr. Swadeep. Namaskar, Shankar sir, and hi, Ritika. We'll take you through a small journey of cancer and nutrition today. My first question is for Dr. Harith. Dr. Harith, all the people who've joined in here and all our audiences and viewers would like to understand one thing primarily, which is that what do you think, or what you could summarize as the sequence of events that happen in a fairly healthy person that lead to tumor formation or precancerous growth? Could you summarize that? Because that gives an understanding of people of how really cancer happens, Dr. Harith.
I guess Dr. Harith has just joined in. He could not hear your question.
Yeah, I'll repeat my question. Hello, Dr. Harith. Sir,
yes, I can hear you. Yeah.
Dr. Harith, I was trying to ask you if you could speak to our audience and let them know that what is the sequence of events in brief that happen to a fairly healthy person that lead to tumor cell formation or precancerous growth? How can people understand the development of cancer per se?
Okay, first of all, thank you very much for having me here. And thank you, Swadeep, and thank you, the whole team of Heal Foundation. And especially, I congratulate you for organizing such wonderful events, because this sharing of knowledge actually leads in solving a lot of problems. So if I have to talk about cancer, how it happens and leads to formation of cancer, the basic thing is that how a simple normal cell becomes a superhuman cell, or becomes a cell which has endless potential to multiply. So there are two unique properties of a cancer cell. One is that it can multiply endlessly, and second is it can spread to different organs and multiply there also. Now, how that happens, there's a triad called a carcinogenic triad, where three things are there. One is the diet and environment. That is important, because one is what you're eating, what you're exposed to, tobacco, alcohol, all these things contribute. That is the environmental factors. Then there's something called genetic factors. So these genetic factors are basically factors which are predisposition. For example, BRCA gene and few other genes. So almost 7% of cancer is genetic associated. Another, there's an important group which is called from infections. For example, human papilloma virus that causes carcinoma cervix. Yes. So this triad is explanation to about 80% of cancer which happens. 20% of cancer, we don't know why it happens. So when I talk about environmental factors, we talk about diet, we talk about sun exposure, we talk about irritants, and including constant injury. For example, a sharp tooth causing injury. All these are clubbed into environmental factors. So these three things together contribute, or rather explain, almost 80% of cancers. As you might be, most of us know that today cervical cancer is almost reduced to 7% of total load it used to be. And the reason for that is that the human papilloma virus, which causes infection, there's a vaccine against it. There are hygiene factors and other practices which have improved. And so there is less incidence of cervical cancer as compared to earlier times. Right. So awareness of diet, lifestyle, and all these things contribute, and fitness level leads to prevention of cancer.
Sir, sorry for interrupting. Sir, can you switch on your camera? Is it possible to switch on?
Yeah, suddenly कुछ हुआ है मेरे phone में.
Click हो गया.
I will have to step out and come in again, because when I joined in, I in between got switched off. I just joined back.
क्या start video का button है sir, वो शायद click हो गया होगा.
Oh.
Start video नीचे जो button. Okay, I think he'll join again. Huh? Please.
So, taking a cue from what Dr. Harit was saying, my next question is for you, Ritika. You know, as a nutritionist who sees cancer patients day in and day out, how much do you, like, he was talking about the etiology, how cancer really happens, you know. What do you think is the load on food and toxicity in the development of cancer? How much percentage or how much aggregation does bad food and exposure to toxins lead to the development of cancerous cells in the body?
Hi, Manjari, and thank you so much for having me here. So, in fact, there is this latest report which has come out in 2020 by the American Research Institute, which actually talks about that almost 30 to 50% of the cancer is the one which is being caused by what is actually preventable and is caused by faulty dietary habits and environmental exposure. So these are the two basic causes where I think all of us have a very important role as individuals, and these are completely preventable. So yes, diet plays a very, very important role in not only at the time when you've been diagnosed, but much before. So I think it starts right at the infancy, or probably I would say at the mother's womb itself. And if you're well nourished, and of course, the entire journey of life, eating a healthy lifestyle, almost 30 to 50% of the cancers can actually be preventable. So yes, diet has a very, very important role in that.
Yeah, no, thank you for saying that, because, you know, although we keep hearing that, giving that number helps, you know, because it gives a very good light on how much the prevention is really an important part of the cancer, because we do understand that once you get into the disease, it's a downhill journey, you know. So prevention is essentially for every other disease, but more specifically for cancer, a very important modality, which not many people are still looking at, you know, as specifically as they should be.
I want to just add one point, Manjari, here.
Yes,
regarding
Doctor.
prevention, that we want people to understand that almost 50% of cancer is preventable.
Yes.
So if that message goes out, you can imagine how the cancer burden goes down. If we are able to really communicate to people that 50% of cancer is preventable. So you have struck a very right chord that we have to focus on that. Yeah.
Yes. No, thank you for validating that also. So I'm now handing over to Shankar sir. I think he wanted to add in something here.
Dr. Harit, I just wanted to ask you, you just told them, said a vital thing that 50% of the cancers is avoidable. Now, what are the steps that common people should take to avoid cancer?
So would you like to take it? Yeah.
So basically for prevention of cancer, so
yes.
basically just very simple things what we all know. I will have to just reinforce that. We all know tobacco causes 30-35% of cancer. Lifestyle, including higher fat content in diet, increased weight, exercise, lifestyle things, they also contribute almost 10 to 15% of cancer. And other than these two, then good sleep. So basically strong immunity also helps in building. So if you focus on tobacco, alcohol, balanced diet, less on fat, more on fruits and vegetables, and exercise and lifestyle. These four things contribute enough that 50% reduction can happen. If we add the infection component, like human papilloma virus, and the awareness and education, that will take another 10%. So actually, it may not be wrong to say that most of the cancers are preventable to a great extent.
So I just like to add, ask one more thing. Is okay, all these things are okay, but there is a heavy, pesticide load on various vegetables and foods that eat. So how does that affect the growth of cancer? All okay, you can eat healthy food, you can have a good sleep, but the pesticide load in food is also quite high.
So just to point that out, that there was this theory that in Punjab, where there was huge usage of fertilizers and pesticides, has higher incidence of cancer, but fortunately it has not been validated by data that that in Punjab the GI cancers are higher. However, we know tobacco cancers are less in Punjab because of the religious factors that tobacco consumption is low. So if I have to say about pesticides, any toxins, any harmful effects are not good for health and should be avoided, and therefore one should avoid use of pesticides, and if they're using, then there should be washing of vegetable food should happen, and that should take care of this. But to support that with data that is leading to certain particular types of cancers, there's not enough data on that, as far as to my knowledge.
Okay, I'll take it from here, Dr. Harith. So, basis what you said, let's take it from the preventive to the treatment modality of cancer now. So, as you treat patients, do you think or do you have, what is your comment on specific nutritional interventions? Because nutrition is the topic of the day. You know, people are using high dose vitamin C, magnesium, vitamin B complex, glutathione, herbals, botanicals, extracts of, you know, spices to really treat cancer. So what is your take on these alternative forms of nutritional therapies, Dr. Harith?
So I leave the alternative part for us to address. What I will say that few things I want to emphasize. One is healthy diet means green vegetables and fruits. That is should be part of diet. Hydration is very important. Physical activity while on treatment is very important because that addresses, improves the patient's immunity and makes sure that the tolerance to treatment is good. We actually encourage people to go and participate in things, activities like yoga and other things. That also helps in coping with the challenges. Other than that, omega-3 fatty acids in nuts and fruits are helpful in immunity building. And those who are coming for investigations and for treatments, the modern regime encourages that we do not have long fastings. So we want them to have short fasting so that their health is well, the nutrition is well maintained.
Okay.
And rich protein diet is always used. Yeah.
Sorry to interrupt, Dr. Manzi. So Dr. Harith, sir, you are running one of the largest cancer institutes in North India. And this is the time, a very sad time and a bad time of COVID. So a lot of queries were coming in. We were also live on Facebook Live where thousands of people come and view. So a lot of queries were coming in with respect to, like, a lot of cancer patients definitely would have been suffering because of COVID. So what is your message to particularly those who are having regular chemotherapy and supposed to have regular chemotherapy or doctor visits and they're not able to go and the fear is there that we should not go to the hospital unless there is an emergency. So what is your message to them?
Yes. So in this period when we have lost about 50,000 people to COVID, I think we have lost 5 lakh to cancer.
Oh.
So just 10 times of the number we lost to cancer. And in the cancer cycle, there are 3 things that get impacted. One is that patients do not come to hospital, so there's delay in diagnosis. So typically what happens, the cancer cycle starts from the clinic in the GP's office, where a person goes with a breast lump or an oral ulcer or something, and then the general practitioner advises that now go for a biopsy. And that is how things start. So when people are not coming out of the house, so what will happen, that diagnosis will get delayed, and that leads to what is called concept of stage migration. So what one would have presented in stage 1, in 2 months' time, it moves to stage 2 or stage 3 and things like that. So one is the delay in diagnosis. Second is interruption in treatment. So most of our treatments are not over in one event, in one cycle. For example, a surgery is not alone enough. You may require chemo, require radiation and repeated visits to hospital. So if you have to summarize that, I'll say any patient requires up to 6 months of treatment cycle. So most of these cycles have also got interrupted, and that has also negatively impacted the outcome. And third group is,
Yes, please complete.
And third group is the patients who are on follow-up. So those follow-up patients have also, so most of the follow-ups we have encouraged not to come out. They have said that only if you have a problem or use video consults and these platforms to exchange with your doctors rather than coming to the hospital.
So, sir, in case of active cancer patients who were undergoing treatment and they were supposed to come for chemotherapy on a regular basis, and what is your message to the caregivers and their families? Is there any particular signs, symptoms, or any stage?
So my message is that do not delay treatment and take adequate precautions. Use of the mask, as I have seen your campaign, very strong campaign, ask for mask. Right. I think it's a very valid
mask.
So use of mask, social distancing, hand washing, adequate precautions. There are so many people who have been diagnosed with cancer. One should know that at Max itself, there are 25,000 employees who come every day to hospital for work. And these employees are not getting disproportionately high number of infections because we are all educated, trained, informed, and we take adequate precautions. So if one is taking the right precautions, one must visit the hospital and take care of what is required and necessary.
So, sir, we did two health writers,
Yes.
healthcare summits and one patient rights summit. And in that summit, we did one with Seva Bharati, and one lot of queries came. And the point of discussion was that because of COVID, so non-COVID, not COVID treatment and medical facilities have been badly impacted.
Hugely
And
impacted.
that's what usually, and that's what you said, that in cancer care also that impact.
In fact, there were two PILs in the government in the court also highlighting this point, that government is too much focused on COVID. But obviously, the courts also directed that there's a pandemic, so the government is given full right to do what and has to face the challenge. So I think while we were focusing a lot on COVID, it is time to shift gears and we also take responsibility for non-COVID diseases. Right, and sir. That is possible by taking all precautions and making sure that people are aware that we have to join the go for treatment.
So one part is a precaution, that obviously that is the common education starting from Prime Minister to the government to all the agencies and media are giving, sir. But with respect to, like, for example, I'll give one anecdote, sir. Just 2-3 days back, one of my neighbor met with a severe accident and he was shifted to a small hospital. And I was coordinating with them that why don't you shift them to Max or any Fortis or any big hospital, because it's a huge trauma. So the question which was regularly coming from the family was, Cookie, is it a COVID hospital? Is there a COVID ward also there? So that fear of COVID.
For the people like you have to spread the message, and I think all of us, not just like you, me, us, each person on the panel has to spread the message that today without precautions, you are not safe anywhere, not even at your home, not in your residence. Mr. Amit Shah, so many dignitaries, so many presidents, vice presidents, prime ministers have got COVID. So they were not visiting hospitals. All that is required is take adequate precautions, and you have to do what you have to do. There's nothing called COVID hospital, non-COVID hospital. COVID hospitals are completely segregated. There's no mixing of patients or staff between COVID and non-COVID. So for example, in Max, we have got smart facility, which is COVID dedicated. So the COVID staff, the building, everything is completely segregated. So anybody who's visiting any Max facility is not exposed to any COVID infection.
So will it be right to say, like, not on behalf of all hospitals, but at least on behalf of Max and your multiple facilities, that a cancer patient who is walking in any of your facilities is as safe as he was before COVID?
I will 100% endorse that with adequate precautions. And I can say on behalf of, I've worked in earlier other hospitals also, that even in other hospitals, adequate precautions are being taken. There is a culture, there's an ethics that doctors and the institutions are protecting the non-COVID patients with adequate protocols. All we need to do is follow those protocols strictly.
So you mean to say that people should stop fearing, and now it is already 5 months, it's going to be 6 months. So don't delay your cancer care, any sort of care, but cancer care and particularly active cancer, if treatment is going on, you should not delay. So last question before I hand it to Manjari and Shankar sir, is that you made a very important statement, because we do a press release and follow-up video and newsletters, a lot of things for the program. So you made a very important statement that if 50,000 patients have died because of COVID, so at least 5 lakh of patients have died because of cancer. So what is the percentage you will ascertain for the delay in care? So one is that regularly these many patients die because of cancer. But
so that is a very difficult thing to figure out, or to get that data. That will take time. If you have to get relevant data, it will take about a year's time to compare that, how you figure out and all that. But what I can say is that during this period when we were treating patients of cancer, for example, we were treating 100 patients, during this period, the care has gone down to 40% of patients. So that means almost 60% people could not reach hospitals or did not take adequate care. Now that is in the first 2 months. After it has started picking up. Today it's almost 75-80%, and maybe next month or two we'll be back to 100%. So there has been a dip in the number of patients who visited hospital. So data to compare how many deaths happened because of COVID is very, very difficult at this point. Maybe we can compare after 1 year and say what happened in mortality data and all that.
So based on your practice experience, there's nothing like that 10%, 20% deaths would have.
We can only say that there was delay in reaching out to hospitals in the months of April, May. More than 60% people could not reach hospitals. In June, July, it gradually improved to 60-70%. In August, it was almost 75-80%.
Nice.
and next couple of months it will reach.
Right, sir. Right, sir. Perfect, sir. So I give it to Manjari and Shankar, sir. They'll just quickly punch a couple of one question, and then probably you can leave, because I think you are in the midst of your practice and a lot of patients would be waiting. Yeah. Manjari,
yeah, so I have one more question, Dr. Harith, for you. If you could please let us, also because you're here and you've agreed to join this little webinar that is happening today, Dr. Harith, I'd want you to help us and put out a clear message for everybody who's going to see it now on Facebook, YouTube, wherever people are watching this, as a leading oncologist and as an oncosurgeon, do you think we are really doing the right type of IEC, the right type of education around nutrition, or do you think much more needs to be done, which can be preventive and in the treatment space, both the spaces, Dr. Harith?
I think not just much more, much more needs to be done. We can add much several times, because see, as I said, there's a huge opportunity of prevention of cancer. Even treatment outcomes depend on nutritional habits and how we educate our patient population. So if I have to focus and tell the people that it is not very difficult to be educated through various sources, including Google and all, but as hospitals, I think we also should take more responsibility and educate. We try to reach out to people who come to our hospitals and especially in oncology wards. But in a general domain, there is an opportunity where all of us need to put our hands together and make it happen.
Yeah. Thank you so much for that.
So one continuing question I'll ask Dr. Harith is that, is there what is the correlation between COVID and cancer, in the sense that if for example, if a patient is on stage 2 cancer and he has COVID, will this speed up the progression of cancer? Is there a data to compare that?
Yes, sir. So what we are doing at present, anybody who's affected by COVID, then the cancer treatment has to be stopped, because the mortality during treatment is higher. So if one is diagnosed with COVID, then cancer treatment has to stop till the person becomes COVID-free. And that typically takes anything from 10 to 14 days. So for 2 weeks of delay in treatment does not have any impact or bearing in the outcome. But if we have the treatment or surgery and somebody is tested positive for COVID, then the post-surgical complication rate is almost high by 25-30%, which is very high. So the current guidelines, based on different data from all across the world societies, is that if somebody is diagnosed with COVID, then interrupt the cancer treatment, treat COVID immediately, and once that is over, then go ahead with treatment of cancer.
Okay. So, so this question is for Ritika. Ritika, if you could, there are two major things that nutritionists face with cancer patients. One is, telling them the right type of nutritional protocol that will, help them through the journey of cancer. And the second is ensuring compliance, because although there is good compliance for chemotherapy and radiotherapy, I still feel that there is really not enough compliance for the nutrition bit. So how do you in your practice ensure that the compliance really happens well,
Here we are talking about obviously the curative aspect and all. And as Dr. Harith said that, once the patient gets diagnosed, that's the time it's very, very important as a medical team, which obviously includes the doctors, the surgeons and all, the dietitians also play a very, very important role. So first is, of course, at what stage is the dietitian meeting the patient for the first time? So in case she, generally for our daycare, we have a huge daycare set up in various places in Max. And so we have a dietitian there. So probably if the dietitian is meeting the patient in the very first time, once the person has just got diagnosed with the cancer, I think the journey is going to be much better and much smoother in terms of the nutritional profile of the person, rather than probably the person being referred probably during the end stage, or probably if the patient encounters some problem. So first and foremost is the time when the dietitian first interacts with the patient is very, very important. And I think this is one media where I would really like to spread in the message that as, any disease, whether it's like diabetes or like a cardiovascular disease, even somebody's got diagnosed with cancer, if you actually are able to manage your nutrition right from day one, the quality of life, and in fact, it will actually help in the it'll also be a very important play a very important role in the curative aspect of cancer, in addition to, of course, whatever the medical treatment, be it your chemotherapy, radiotherapy, or the surgical intervention. So it goes hand in hand, and the sooner you catch the hand of the dietitian, I think the better is the quality of life.
But compliance is always a concern. So, so how often is this follow-up done to ensure that compliance happens, and how closely do you interact with your patients at Max?
Again, it all depends, because again, for cancer patients, they are not the ones who are with us in the hospital, right? So probably when they're coming for the chemotherapy, or probably when they're visiting the doctor, that is the time, if there is a dietitian in the OPD setup, it will really help, because we really do not want our patients just to come in to the hospital to take a visit to the dietitian, and especially during these times. But yes, whenever they're coming for the chemotherapy or probably visiting the doctor, it should be mandatory, if not, at least mandatory, to at least have a sitting with the dietitian, because probably, each and every week, the diet probably, as I always say, one diet doesn't fit all. So probably a diet plan which is being given to a person at the beginning of the treatment probably would be completely different going forward in the next few weeks or months. So it's very, very important. Now, coming and talking about our experience in with the institute where I work, so we have, like in certain setups, we have a dietitian who's only looking after the daycare patients. So she gets to interact with all the patients whenever the patient is walking into the chemotherapy. But in a larger setup, probably that's not possible. And the reason for that is, of course, the number of dietitians with respect to the number of patients who are there. So probably we are just interacting with the patients initially when the first time the patient walks in, and only later once the patient has a requirement for a dietitian. So I think that is where the gap is there. And I think that if that gap can be lessened and overcome, I think then, of course, it will be like a great help in the, getting into a better quality of life for our patients.
Shankar sir, anything?
Yeah, this question from one of the members who are the audience. It says, has the outbreak of COVID-19 increased the demand for oncology dietitians who help in treating who help the treating oncologists provide comprehensive cancer care during pandemic?
So again, talking from my own experience, because Max Healthcare is one of the biggest institutes for COVID treatment. And as like Dr. Harith said, we have a completely different unit where our patients are there. But as dietitians, we do make a call to all our patients. So it's not only cancer care, but each and every patient who gets admitted for a COVID treatment in the hospital, the dietitian does interact with the patient. And of course, when we are interacting with the patient, we do take the diet history. So yes, I do interact with a lot of patients who have an underlying condition, or whether it's cancer, or probably I've had 2-3 patients who've had a kidney transplant and have gone in to have this COVID positive treatment, undergoing the COVID positive treatment now. So yes, the treatment would be a little different as compared to a person who's probably just asymptomatic, or probably just absolutely healthy with no comorbidities, but being diagnosed with COVID-19. We also have a home care system, and I have at present almost about 40 odd patients who are COVID positive, but are in home isolation. So there also, I have a few patients who are undergoing active cancer treatment, but have been diagnosed with COVID-19. But again, as I said, we really need to look into the underlying disease and prescribe the diet accordingly. And it will be a little different from a general healthy population who probably has got COVID-19.
If there is a COVID patient who is, who has cancer and he's come for treatment, will his diet differ from persons who are not cancer patients but are COVID positive?
So it all depends, as I said, it'll all depend upon the line of treatment for cancer. So probably if I get a patient who is a multiple myeloma, the WBC count or the neutrophil counts are very, very low, and the patient is on a neutropenic diet, probably I would not be prescribing a normal COVID diet, wherein we talk a lot about increasing the vitamin C, having a lot of fruits and vegetables, increase amount of hydration in the form of fresh juices and lemon water and fresh coconut water, because we really need to follow the guidelines of the cancer treatment protocol. But if it's just a general cancer patient like a CA breast who's undergoing a chemotherapy with all the blood parameters being absolutely normal, but got diagnosed with COVID-19, then the protocols of the COVID-19 nutritional management will apply to the same patient. So obviously it's going to be case specific, But yes, whenever a dietitian is interacting with a COVID-19 patient, we do need to take the underlying comorbidity in case if the patient has any.
Yeah, Manjari.
Yeah. So, for the benefit of our audience here, Ritika, can you just give us a list of foods generally in cancer care? Some of them which are good for them and some of them which are, you could even do the categories if you'd like. For example, the sugars, the inflammatory oils, dairy. Could you give us an understanding there of what they should be doing generally and what they should not be doing as an
again, very interesting. I was actually going through the American Cancer Institute guidelines, and very interesting to understand that the first guidelines came back way back in 1950s and all, and every 3 years to 4 years they actually update and come out with the fresh guidelines. But when I actually looked into the nutritional and the physical activity guidelines, the 5 basic points remains the same. So first is, of course, making sure that you have an adequate or a healthy weight. And when we talk about a healthy weight, the only difference which has come along during the course of time is look into your lean muscle mass and make sure that you have less of body fat percent. So probably that's one difference which I think we really need to look into as dietitians, which is very, very important, and not just talk about healthy weight. The second is, of course, a lot of emphasis on your physical activity, which I think Dr. Harith also spoke about, which is very important. The third and the most important, and that's where we will talk about the various food items, is, of course, the emphasis on having fruits and vegetables being very, very helpful, not only in the preventive aspect, but also in the curative aspect of cancer treatment. And of course, when we talk about fruits and vegetables, of course, the basic reasons why we are emphasizing so much of fruits and vegetables is the various components present. So be it the fiber content, which of course has multiple benefits, especially for cancers like colons and stomachs and the GIs. And of course, the presence of various phytochemicals or antioxidants, which we know are present in good amounts in your fruits and vegetables. But yes, there are also a list of foods, or I would say category of foods, which have been found to actually precipitate cancer. So, we talk about having, excess amount of fat, or probably having excess amount of meat, red meat and processed meats in particular, which of course, there have been a lot of research to show that, yes, they have a direct impact on precipitating certain kinds of cancers, right? So especially your colon cancers and your GI cancers. And when I talk about, so if you ask me the list of foods which I would say are not so good, I would really, the first on the list would actually be your processed foods, specifically your processed meats. And that's for the simple reason that whenever we are processing meats, there's a lot of use of nitrates, and, and these are the ones which get converted into your the so-called carcinogens, the moment you're heating them, etc. So that's one of the reasons. The second is, of course, also there are these certain carcinogens which are present in your processed foods, and these are your aromatic, hydrocarbons, etc. So these again would be one of the reasons for precipitating cancers. So definitely you need to look into the consumption of the processed foods, which have really exponentially increased over the few years. So that's one thing. The second is, of course, again, there's a lot of myth about certain foods, and I think as dietitians, we really need to educate the public that when we talk about food, food is an amalgamation of nutrients. So it's not that one particular food would only have one kind of nutrient. So when I talk about a vegetable, or when I talk about a dairy, when I talk about any of the other foods, I need to understand that there might be something good and there might be something bad. So if you're having a food in moderation, you're probably getting all the benefits of it, and probably not so much getting affected by the ill effects of the food. So for example, let's take the example of dairy. So there's a lot of information in the markets, the moment you start Googling, you'll have one set of people talking about that how bad is dairy and probably precipitates cancer. Now, there are certain research to show that increased amount of calcium in your diet, and specifically getting the calcium from your dairy products, will prevent certain cancers, especially your GI and the colon cancers in particular. But there is also a set of study which says that taking large amount of large amount of calcium, and especially from the dairy products, would probably have a higher incidence in prostate cancer, right? But again, as I said, when we talk about a nutrient, or when we talk about a food, it is not just one nutrient, but it is an amalgamation of different nutrients present, which makes it a food. So I would not say that, yes, dairy is a culprit, But if you can get the best source of dairy, you're taking it in moderation, you're taking the right quality of dairy, in the sense you're not taking a whole milk high in saturated fat, I do not see it being a positive factor for precipitating any cancer. Similarly, I think sugar is one thing. We talk a lot about that, your cancer cell feeds on sugar. Now, sugar, yes, does not have any nutritional benefits for any one of us, be it a cancer patient or for a normal patient. Sugar is just simple calories, which are getting, you are having it. But to say that sugar directly feeds on, your cancer cells are directly feeding on the sugar which you're taking, I would not agree with the fact. But definitely, sugar does precipitate obesity, which is one of the factors for cancers. Sugar does lead to high insulin levels in the body, which is a causative factor, specifically for certain types of cancers, like your breast cancers and your endometrial cancers. So, yeah, what I would say is that, follow the moderation path. And when you talk about sugar, it is not only the sugar which you are adding to your tea or the dessert is your sugar. It's any kind of refined carbohydrate. So the message which needs to go out to the public is that, yes, you need to cut down on the sugar, but don't forget it's only the teaspoon of sugar which is doing you harm. People stop having their sugars, but probably they're having a lot of their biscuits and breads and, all your refined cereals like maida, etc. Not realizing that that is also equally as harmful as having a teaspoon of sugar, right? So yes, these are the things. And of course, there is a long list of food. We can just go on and on. But I thought I'll just talk about dairy and sugar, which is the most talked about.
Yes. I think so.
Can I ask one question? So, Ritika, so cancer nutrition itself is a specialized field, and you have certain type of recommendation for cancer patients which you follow, and you try, maybe you would be customizing also based on different type of cancer patients, in what stage they are, what type of patients are they. So my question is with respect to COVID, and we have been discussing in a lot of our webinars and summits when Manjari and a lot of other people have also been there, that the COVID, one of the biggest change has also come in food habits because of work from home, the lockdown, not going out. So a lot of people, we have seen, they have become themselves, they have become chefs. Those who were not cooking have started cooking. A lot of experimentation initial days with respect to variety of food and all those things have been happening. A lot of people have started when the restaurants and home delivery has started, they've started depending and ordering for. So in this change, what you have witnessed in the food habits and type of experiences your patients and your people share with you, what is something do's and don'ts with respect to change which you would recommend to the cancer patients?
So the good and the bads of the COVID times, as I say to all, whenever I'm attending webinars and I'm talking to my patients or to the general public as such. So the good part is, of course, people have realized that eating simple ghar ka khana, what I call, is very, very healthy and doable. And of course, really over a period of time, in the initial times of COVID, what we found was that people were getting more healthier in what they were eating, right? So that was the good part of COVID, that probably suddenly, there was no access to getting to restaurants or eating fast foods and all. People started cooking at home, and they suddenly realized that eating home food is also possible, and it is probably the most healthiest thing which you can do. The second thing is, of course, going on the other side is, we know for sure, especially I'm talking about cancer patients, that we know physical activity has a very great role in preventing cancer as a curative part of cancer also. And what the COVID has done is that the physical activity for the general population has almost come down to zero. And it's, in fact, now that we are in unlocked times, we've been actually telling people that, it's a good idea to probably move out of the house, go out into open lawns, probably early in the mornings or late in the evenings when there is no crowd, and start your exercise and resume your physical activity again, because that is also doing a lot of harm. So initially, in the first 2-3 months, we saw people losing weight, being more active, the sugars getting controlled, the cholesterol levels were getting better. But now, stepping into the 5th and the 6th month of COVID, we've actually started seeing that people have started putting on weight. The stress levels have gone up, and of course, the ill effects of this has actually been seen in the kind of blood parameters of the disease, what I would say. So for the cancer patients, what I would suggest is, one, Yes, good thing is that you start eating home food, fresh food, cook it yourself, and that's the best thing you can do. The second is, there was a lot of myth, or there was a lot of this thing which is going around the corners with saying that people had stopped eating fruits and vegetables, thinking that probably it's infected and the virus is probably there. So I used to be getting a lot of calls from people, patients saying that we're not buying fruits and vegetables because it might be infected with COVID. So let me assure everybody that till date, not a single research has proved, and it is there on WHO, our own FSSAI has been talking about, that the COVID-19 does not spread from your fruits and raw fruits and vegetables. Yes, you need to take the proper precaution. And again, simple things like washing under running water for 2 to 3 minutes is the most efficient way of getting your fruits and vegetables absolutely hygienic for you to eat it. So that's what we've been telling everybody, that please make sure that you're eating enough of fruits and vegetables. Just wash them thoroughly. And then whether you want to have it in the raw form or in the cooked form, please continue having that, because that will actually help in your cancer treatment also. And as well, it's a very healthy way of eating to lead a healthy life for the general population anyways.
So like one of the trends which I also is a lot of Ayurvedic supplementation being prescribed and taken up. Like one of the commonest thing now people talk about is something like giloy, that every morning start taking giloy. A lot of things, such things have come in. Some are good, some may be overhyped, and but of course to build immunity, a lot of recommendations from you nutritionists have also been coming that you should start taking these. So with respect to these supplementation, particularly the Ayurvedic ones, is there any precautionary note to cancer patients who are undergoing chemotherapy or undergoing treatment?
Yeah. So first and foremost, yes, the Ministry of Ayush has come out with this recommendation, which talks about the importance of the various herbs which are locally available in India and has been found to improve on the immunity. So that's a good thing which has come during this COVID time, that suddenly the importance of all these herbs and spices which were there readily available in our kitchen and probably we were just neglecting it, has suddenly proven its importance during this time. So yes, it is very good. But a word of caution is very important, for especially people who are having some or the other kinds of comorbidity. For example, we have kidney patients. Potassiums are very high. I've had 2, 3 very recently episodes of people walking into the hospital with potassiums as high as 6. But they've been taking, lemon water, because we've been all talking about having excess vitamin C because it helps you in building up your immunity. So if somebody has a comorbidity, I would really suggest that please get in touch with your doctor or dietitian to tell you what is the correct thing to have. Now, coming for a cancer treatment, again, most of these herbs and spices which we've spoken about are absolutely safe, should not cause any kind of problems. But like a person who's undergoing an active treatment of chemotherapy, very, very high doses of vitamin C is prohibited. Actually, it interacts with the drug. So most of us are having vitamin C supplements. We are actually, loading our bodies with amlas and nimbu panis and all the kinds of vitamin C. So for a healthy population, absolutely fine, because the excess gets flushed out of the system. But if you're undergoing an active cancer treatment, and if you're on a particular drugs, which might interact with these kinds of supplements, especially your, excess amounts of vitamin C or very high amounts of your zinc also has been found to be toxic, or excess amounts of vitamin D and vitamin A can be toxic, specifically if you're undergoing an active chemical chemotherapy. Therefore, very important for you to please get in touch with your dietitian. She would be the right person to tell you how much and when to take all these herbs and spices. But most of them, otherwise, whether we talk about the little kadha, we talk about ginger, or we talking about your cloves and cinnamon, are absolutely safe for most of the patients.
So like what has definitely also brought into center stage is the immunity thing because of COVID. This has come up in discussion and it has been top of the discussion amongst the doctors, nutritionists, and people have also become very cautious and be aware of building immunity. So we are also doing an immunity conclave 17th, 18th September focused on immunity. So what is so this immunity definitely is important for COVID. So what is the role of immunity, what you have seen in your practice with respect to different type of cancer patients, where immunity has played a role in with respect to better recovery for a cancer patient?
So yes, so immunity does play a very, very important role. And of course, when we talk about, the cancer treatment or the curative aspect of diet in cancer, there are two aspects of it. One is, of course, the macronutrients. So you need a basic amount of calories and proteins and fats so that your body is not into a catabolism state and is able to take in the chemotherapy, and you still have the energy to lead a normal quality of life. So that's the first aspect of giving a basic, healthy, balanced diet to cancer patient. And again, it will be different. It will be very much individualized depending upon the kind of cancer and the stage of cancer, etc. The other thing, which of course, as dietitian, I think there's a lot of research happening, and there is, of course, a lot of information which is there, is about the so-called micronutrients and what we call them as the phytochemicals or the antioxidants. Now, these are, of course, nutrients which are required in very, very small amounts, but are the most essential component for your macronutrients or for the body's absorption of these macronutrients to happen. So again, whether I'm talking about the vitamin C or the A's or the zincs, etc., these are very, very essential for a cancer patient to consume it. But a word of caution is very important, that most of the time, especially when a person is on active treatment, we would really suggest that they should take all these micronutrients and the phytochemicals and as well as the antioxidants in the natural form as far as possible, and do not take any kinds of supplements, for the simple reason that one, the supplements are giving you only one nutrient at very mega dose, can be toxic to the body and can interact with your treatment. And the moment you take it as a natural food, you not only get the benefit of a particular phytonutrients, but when you're consuming a food, you get the other benefits of whether it's the fiber, the proteins, and the other nutrients which we talk about. So for cancer treatment, yes, eating a high amounts of fruits and vegetables is what is being recommended. And this is not only recommended by a nutritionist, but any guidelines, whether we're talking about the UK, the United Kingdom, we have our own guidelines, the Indian guidelines for cancer, or we talk about the American guidelines, they all emphasize a lot on taking good amounts of whole grains, your nuts and seeds, and the fruits and vegetables, because they not only give you the macronutrients, but also the micronutrients and the phytochemicals in a varied form, and makes your diet more comfortable.
So you're doing yeah. So can we have a last question, Manjari, before the health minister joins?
So I think Ritika has really given a very good breakdown of a lot of common questions that keep coming in. Like you said, the herbs, the dairy, the sugar, we've gone through that. My last question is the toxins, the exposure to toxins which are carcinogens. Can you list some common toxins which I and you and most people in an urban setting would encounter, and what are the quick steps they could take to keep the toxins, environmental toxins at bay, and not allow them to become cancerous or cause those mutagenic changes in our body?
Yes, in fact, what Dr. Harit said, when in fact the Max Institute started off, and he used to go to places in Punjab and all, and that's the time I used to interact a lot with him. And there were instances that suddenly the incidence of cancers in those areas are high because of the pesticides and insecticides, right? So yes, but again, as he said today, that there are no data to validate that. So that's one of the most important reasons. So when we're talking from the production aspect, the using of a lot of insecticides and pesticides, of course. The second is, of course, all the kinds of these metals which are there, whether we're talking about arsenic or talking about all the heavy metals which are there, whether you take it from the fish or you're taking it from the foods, etc. So those are the second toxic metals which are there in our diet, knowingly or unknowingly you tend to eat. And of course, the third is, of course, the processed foods which we talk about. So again, the amount which is present would be very minuscule, but we really need to understand that from hunters where we were eating completely raw and we were completely we were following this path of farm to fresh, we've suddenly diversified and we've moved to the other extreme of the spectrum where we are probably completely dependent on processed food. So these are the three basic things. One is, of course, the fruits and vegetables where they're grown, or any grains for that matter. So there's a lot of there. The second is, of course, the heavy metals, and third is, of course, your processed foods. So if you're careful about these three things, I think that actually forms the majority of the environmental toxins or the pollutants which I can think of.
Thank you, Ritika. Thank you. Now we have with us Honorable Health Minister of UP, Shri Jai Pratap Singh. Namaskar, sir. Welcome to our 6th episode of Heal Thy Samvad, sir.
Namaskar. Thank you very much.
Thank you. So we have with us Mr. R. Shankar, who will be moderating the session, sir. And just before this, we had a very interesting session on cancer care and the role of nutrition with Dr. Hari Chaturvedi, Chairman of MAX, Ms. Ritika, Head of Dietetics MAX, and Ms. Manjri Chandra. So now, Ankit, can we have a formal introduction of sir before we start this session? Ankit?
Shri Jai Pratap Singh Ji is Minister of Medical and Health, Family Welfare, Mother and Child Welfare, Government of Uttar Pradesh. He's an Indian politician serving in the Yogi Adityanath Ministry of UP government. Shri Jai Pratap Singh has been MLA for 7 straight times since 1989. He represented the Bansi Assembly constituency as a member of Bharatiya Janata Party. In 7th Legislative Assembly of Uttar Pradesh 2017, he was appointed as Cabinet Minister of Excise and Liquor Provision in government of UP. On 21st August 2019, after first cabinet expansion of Yogi Adityanath, his ministry department was changed as Minister of Medical and Health, Family Welfare, Mother and Child Welfare.
So a formal welcome to you, sir. And before Shankar sir takes over and puts up a few specific questions to you, sir, I will start with a bit of background. First of all, let me congratulate you and your ministry as well as the UP government overall in being in a very safe position with respect to COVID today compared to a lot of other states, in spite of being one of the largest state, one of the largest populated and a very complex geography and democracy of the state. Yesterday, I was reading a report of 5 most badly affected COVID states. And fortunately, I saw that UP was not there in the 5 most badly affected. So one of the key reasons of this have been what we have understood and read and been hearing about is that your promptness with respect to how very quickly you formed Team 11 and the Chief Minister and the group of ministers, they acted very proactively by forming a COVID task force. And with respect to all the decisions you have taken from the quick early lockdown to the implementation of lockdown, the scaling up of the testing, scaling up of the facilities for the COVID care, so quarantine facilities, everything has been working quite good till now. One of the key questions, sir, with respect to, like, if I read few of the facts, that like in health infrastructure has been scaled up in record time. 78 hospitals of level 1, 64 government hospitals of level 2, 6 hospitals of level 3 with a combined bed capacity of 52,000 have been set up, covering every district of the state. 53 units manufacturing PPEs, 99 units masking sanitizers, and 412 units making medical equipment and medicines have been made functional in the state in the last 2 months. Third, the Yogi Adityanath government and your leadership, you have been also been providing a huge economic relief to the laborers and the migrant workers, what you have been doing, and a lot of other schemes for the migrant workers, even rehabilitating them in the state and providing them job and all what you have been doing. So before Shankar sir starts with the conversation, my question would be, and this has been coming from a lot of queries because we are on live on Facebook, YouTube, and a lot of other channels. I hope thousands of people would be watching this, sir. Is with respect to the IT interventions. I didn't read much about the technology and the IT intervention. What UP government, like comparatively, if we see some things Delhi government has done, some apps and all, Hyderabad, the Telangana governments and all, a lot of other states, Karnataka states have implemented. So what is your initiatives with respect to technology, use of technology in COVID management, and any roadmap and or any immediate plans you have, sir?
Thank you very much. And I'm been honored to be on your webinar along with other esteemed guest over here. I would like to tell you that Uttar Pradesh has used a lot of technology, but not as what other people or other states have used in terms of apps. We have consolidated our entire system on the basis of portals where we monitor each and every district from a centralized command center, which we made in our directorate, which collects figures of each and every case, and every case which is identified, their contact tracing, the surveillance, every home isolation person who is at home is being monitored. We have a technology which monitors them, and call centers will monitor from the state center to the entire state. And roughly we are doing about 25,000 calls per day. Plus we have district command centers which also manage the same amount of work. But basically what we've done is centralize everything from one point. And from there we get the figures of whoever is infected and the recovery rates and the death rates. And then we control and watch directly as to how many surveillance teams have been made, how many contact tracing, how many RR teams have been made, how much testing is being done. Everything is done from there. So because UP is a very large state and we have a population of about 24 crores, to manage it, we have a huge workforce also. Along with the health department, the government on its own, I mean the administrative part of it in every district, where you have a district magistrate and different types of administrative officers. Along with them and along with our medical staff, we have managed the entire process of identifying and what do you call it? The patients and putting them into hospitals or looking them after at home isolation cases, or the testing part and all the infrastructure which is connected to it. Everything is monitored from the district level right up to the state level. So basically, we haven't got down to making apps as such. The only app which we use as app, you must be knowing also, is the Arogya Setu app, which about 2 crore plus people have already downloaded in UP. And we've already made, out of 2 crores, I think we made calls to almost about 26 lakh people who've been identified using the app, and where we get to know if they are around any positive person or if they are infected themselves. Apart from that, we are working as a team right throughout the state with all departments concerned. And we have so far managed, as what you must be seeing the figures, everything is on the website. So UP figures are also over there, that with a population of 24 crores, today we have cases so far which have come up right from the starting of March till now is about 2,47,000. And we have a recovery rate of almost 73% or 74%, which is 1,79,000 people have already recovered. And so the active patients, we have about 57,000 in hospitals or in home isolation or something like that. And our deaths is also around 1.5%, which is about 3,800 compared to our population. So overall, the basic strategy has always been, because our Chief Minister is very, very active on the spot all the time. And he was the one who formed the COVID-11 group, the group 11, which manages, which we meet for the last 6 months. We'll be meeting each and every day without fail, without any holidays. So we meet every day in the morning, and all departments which are working together in every aspect is monitored, their progress is monitored, and accordingly we take decisions every morning how to change our strategy as to the number of patients which are coming up and how to deal with it and all that. So in a short way, I'm just trying to tell you that what all we've done. Yeah.
Yeah. So we have Mr. R. Shankar. He's the president of Heal Foundation, and he was the editor of New Indian Express and a very senior journalist based out of Kerala. So today he's moderating the session, sir. So he has some very specific questions to you, sir.
Okay.
So over to Mr. Shankar.
I'm Shankar here. Now, for people from other states, can you briefly tell us what exactly is this Team 11?
Our Team 11 consists of about 11 departments, including our health department itself. Of course, we have senior officers like the Chief Secretary and the Director General of Police They themselves are there. And apart from that, you have the other departments, which is you have the Panchayati Vibhag, which I think, I don't know how it's called everywhere else, but it's the Panchayat Vibhag, which we call over here. We have the Revenue Department, we have the Nagar Vikas Department, we have the Agriculture Department, we have the Industry Department, we have the MSME Department, we have the Animal Husbandry Department, and all these departments are connected, and every day we meet with them. Basically, everything is connected to each and everything where the COVID thing. When COVID took place and when the cases and when the lockdown took place, how to ensure that people who are in the villages, on one side you have a total lockdown, on the other side you have a huge 60% population of UP, which was already involved in farming at the time of end of March and April when they needed to harvest their wheat. So how to allow them, that strategy had to be put in place where they were allowed to go to their fields and use harvesting machines and all that, so that they could take back their wheat and store it and take it to the state purchasing centers and all that. All that had to be worked out, and the number of migrants which were coming out, which is the most important thing. When the lockdown happened and towards the end of the lockdown, when people started coming back to UP, we had to arrange quarantine centers at every district level, and every road which went into each and every district, and wherever the roads were, they were all covered by police personnel. Every road was blocked, and so that whenever these people came, they were a group of workers of the departments, different departments, revenue department, agriculture department. Everybody was there. Everybody was helping out to note each and every person who came in, had the inspection done by infrared thermometers, had the oxygen level checked at that time, and then put them into quarantine as and when required. If they had little bit of fever, anything like that, we put them into a L1 facility. At that time, it wasn't so much, but we got about almost 30 lakh people or 32 lakh people who came back into UP at that time. And so management of them, and while managing them, we were sending them back to the villages if they had no other indication of any type of fever or anything like that, ensuring that they got 1,000 rupees into their accounts after checking their account, and giving them a huge bag of food grains and all, so that they could manage themselves for 1 month. So this entire process needed to be interacted with all the departments concerned, right up to the district magistrate level, where the district magistrate ensured that everything was there. And each and every person was tagged, and his number and details were noted and put into a computer. Also, at the same time, we ensured and found out if there were any skilled labor. Skilled labor, I would like to say that like you have a driver, you have a carpenter, you have somebody who had a hairdressing salon, you had any work they used to be doing. They might be using an auto rickshaw, anything. Everything was noted down into a computer, and then we kept it for our own requirement whenever it's required. So all these things were done at the same time. So 32 lakh people coming in at that time, and ensuring that they went to their homes. They were monitored at their home level by a different team of people. We involved the Gram Pradhans, we involved the medical staff, we involved everybody into that. And so we ensured that this entire population came, and they were perfectly okay. There was no problem. Whoever had a bit of a problem went into a L1 facility, or if he was a little bit serious or had other diseases, we sent him to a different hospital which had tertiary care sort of system. And we managed all that from the time they came. And today our strategy is along the same lines. We've increased our testing from the time in March, first week of March, when we used to have about 150 tests in a day, which we had only one machine in the King George Medical University, to 150,000 today, plus in fact, tests per day we are doing. And we've increased the number of machines everywhere. We've added ventilators, we've added NHFCs, we've added all possible machines at tertiary care level, so that we can ensure that anybody who has comorbidity and needs extra care, we put them into those hospitals where they are taken care of, and they're treated and they are taken out. So this sort of a system we've generated from the time, and because we have a chief minister who takes very quick decisions on the spot all the time, he ensures through those meetings that everything is absolutely perfect. The ambulances should work. The food should be given. Patients should be talked to in all our facilities from the time the patients have been there. Either the Chief Minister talks himself, either I speak to some of the patients for 10 districts and 2 patients in each district. Almost each day we speak to them, or through the CM helpline and through other agencies, constantly in touch with all the patients at every level to ask them if they're getting food, if they're getting enough nutrition, if they're getting medicines, are the doctors taking round. All this we've evolved over a period of time, and the strategy is working till today.
There are reports that India is likely to peak somewhere between January and March or April next year. Is there anything special, a special strategy that you're formulated anticipating a huge spike during these months, that especially when India peaks? Is there anything that you're planning now itself?
At the moment, we are not planning anything, because whatever planning we are doing right now, because we are seeing the cases, number of cases increasing in UP, and we have an average about 5,500 cases per day. And in the last 23 days, I think we jumped from 1 lakh something to 2 lakh something. And of course, the figures are all there. The idea is to only ensure that our bed capacity is available at every stage. We had already provided for 1,50,000 beds plus, 1,50,000 to something. But now we are also seeing a different trend in cities. We have about 10 to 11 cities which are heavily populated, especially the capital Lucknow and Kanpur, which is coming out with a large number of cases each day. To ensure that these cases are properly divided into home isolation, into L2 facilities where they can manage with a little bit of oxygen or with HNFC, or if they require ICU and critical care, then we have all these medical colleges. We've attached all the private medical colleges, good hospitals. Everybody is connected to our system now and become dedicated COVID hospitals also. So according to the requirement, we ensure that these patients are well attended to and they are shifted to these patients. And then we have a lot of input in patients coming in from Eastern UP and around Lucknow. So it's not so much that the Lucknow patients are in large numbers. The numbers show actually people coming from outside. And yet we have to manage with them also, because we don't have that sort of facility everywhere just now in UP. So this is what we opted, and I don't know if in January to March, if this figure, I mean, if the corona peaks or not peaks. At the moment, we are going through a tough phase where we're seeing it as it is peaking in all the districts and all that. So we are being very, very careful. And our basic strategy at the moment is only to do maximum amount of testing, identify all these positive cases, put them into home isolations as required, or give them treatment if they have any sort of problem. The more we take them out, the more we treat them and then send them back to society is a good sign. Otherwise, these people are roaming around all over things. If they infect people who are 60 plus, or if they are infecting people in their families who have comorbidity, then it becomes a bit dangerous also. So we want to ensure everything that side. So we're doing our best as far as that. I think one of your questions, which Mr. Swadeep had also sent to me, was on the zero survey system.
Yeah, zero surveillance, yes.
Yeah. So we are just starting that tomorrow. We had already cleared it to start about 15 days earlier, but because we were involved in some other thing, we sort of delayed it for 15 days. Tomorrow we are doing it in about 11 districts. And we have a system.
Where in Lucknow? Or where are we starting it?
There are 11 districts, I think.
Districts, okay.
11 districts. In especially those districts which already have a larger percentage of cases coming up in sort of big towns and cities and all that. So we are starting it from tomorrow, and every district will have about 10 teams. We'll take up clusters of say 6 houses or 10 houses like that at a period, and we'll ask their permission. We'll tell them what we are doing also, and then after getting the formalities done, we do the zero culture survey. We do a zero survey, and let's see what the thing comes out, what the result comes out as to how much percentage of people are already may have been infected and already developed a sort of antibody system in their own bodies. So let's see what the system comes out, and we'll see. But we started this from tomorrow. Starting this from tomorrow.
Probably that will also give you a fair idea of whether people have started having herd immunity somewhere in certain areas. Probably that will give you an idea, because you will know that they are infected, but they have infection, but they are not spread it across.
Pardon, I didn't get that.
No, probably the survey results will also tell you if your state is moving towards some sort of herd immunity, where people are protected.
Yeah.
So that also might give you an idea.
Yes, exactly. That will give us an idea as to how much it has already spread and become people have become like a herd immunity. Definitely, we will get definitely some results on that. And I believe some other states have also done it in different parts of the country, where percentages are quite high, I believe. But let's
Yes,
see.
Delhi has done it. Delhi has done it. Pune has done it. Yeah.
Yeah. So that sort of thing.
Yeah, I wanted to ask you one question. Is during you just spoke about lockdown, which had a lot of effect. Now, during this lockdown period, did the UP government take any steps to help non-COVID patients reach hospitals?
At that time, during lockdown, I think all the hospitals were also closed at that time. One thing I'll just tell you is that the deliveries took place continuously. We were monitoring that. Regular deliveries at our government institutions were carrying on despite the lockdown, because you cannot stop those. Those are like,
yes,
the time has come, so they go to the hospital, and they were used to. So we had a large amount of deliveries happening at the same time. And of course, we had stopped all OPDs in our district hospital and our lower hospital also at that time. But once the lockdowns finished, we opened up our hospitals, we started the OPDs, we started doing minor and major operations, we started doing ANCs, we started having deliveries which were already being done, and we provided them with a lot of machines. You see, problem was our doctors were getting a bit scared that when a patient comes in, a non-COVID patient comes in, and if he has a little bit of symptoms of fever or coughing or whatever it is, they would not treat them. So immediately our Chief Minister decided, and we implemented TrueNat machines in every district hospital of ours. That is 75 district hospitals we have, and few other big hospitals which we run. So about say 100 TrueNat machines we installed straight away, which would allow and gave them PPE kits and a lot of other suits and things like that, so that they can be protective covers and everything, gloves and face masks and things like that. So all that was given to the doctors plus TrueNat machines, so that they could ensure that any patient they felt was a little bit COVID infectious could be put in a holding area, and automatically he would be seen in 1.5 hours time or something. He'll be diagnosed whether he's negative, whether he's positive. So since then, which has been almost now about 1.5 months, and we monitor that even in our COVID-11 meetings, the CM asks us every day how many operations, minor operations have been done. We have a district-wise data, and each district, she can ask from any district as to this district and the doctor's name and the doctor's mobile number, which doctor has done how many operations, which gynecologist has done how many operations, how many deliveries, everything. And also regular activities of the health department, which we started a little late, of course, because we lost out on April, May. And towards the middle of June, we started doing a immunization program, which is a very important program all over India as well as the UP, because we have to do the newborn babies, we have to get them immunized, the basic immunization. And also other activities where we have vector-borne diseases in different parts of UP, malaria, Kala Azar, Japanese encephalitis, AES, dengue, chikungunya, filaria. So many diseases we have, and we have a program for each and every one. So we started all those programs from June, mid-June, and we ensured that simultaneously they were also being done at the same time. We are monitoring those also. We are monitoring the immunization also. And the corona is being monitored separately, and all our other systems are working at the same time.
So during this huge lockdown period of 40 days and what a long period of almost about 2 months, 60 days, ongoing programs like immunization against TB, against Kala Azar, against, were they affected malaria, were they affected to some extent?
Yeah, they were affected because there was a total lockdown at that time.
Yes.
So we couldn't start a program. We started it end of May or June, we started it. And then once the lockdown period started finishing, then we opened up our hospital, we started our program. We ensured that the people went out. And I mean, surprisingly now, also a very big thing which the Chief Minister took a decision was sanitization in each and every village, of course, within towns as well as villages also, and the cleanliness operation we started, where every, in the villages where you have all these nalas and all that, and you have in big town areas and nagar palikas and nagar nigams and big cities where you have big drains and all, which are always clogged normally. But this he took it as an advantage during this lockdown and just after the lockdown finish to start cleaning up the entire thing. Now, when you clean up garbage, when you open up drains, when you're cleaning up nalas in villages, everything started looking neater and cleaner, which also helped us in our diseases also. Normally at this time, we get a lot of patients on Japanese encephalitis, AES, malaria, and so we have deaths also. But this time the figures are much, much less than last year. So it has come as a help because when you have a different departments working together for their own this thing, it helps in each other department also. So we are a little better off that way. Now everything has come back to normal.
Yes, Sudeep, you wanted to ask something?
Yeah. Sir, my question is regarding currently I'm from UP and I'm started getting a lot of queries related to plasma therapy and plasma bank. So I got a few calls from Gorakhpur and other places. So is there any specific plan? Because like, for example, plasma bank in Delhi by Delhi government worked out very well. They set up specified destinations as plasma hospitals, they turn plasma banks. So I came to know while I was checking yesterday that Lucknow Medical College also you have set up a plasma bank and plasma is available. But UP is a vast country, vast state, sir. So is there any specific plan for plasma bank or facilitating plasma therapy for the COVID patients?
Yes, King George Medical University has started right in the beginning. In fact, before Delhi started it, we'd already started doing some giving plasma to certain patients at that time, and it had come out in the papers also. Thereafter, there's a plasma bank in the medical college in Lucknow, and we are collecting plasma. And the idea is to also in all the other medical colleges around the state, the big medical colleges like or the big major centers like Gautam Buddha Nagar, Meerut, Muradabad, wherever we have big medical colleges that are already working, we want to start having plasma and platelets. All this we are going to have. We already have a lot of blood banks and centers and all that. So we're going to start doing that also and collecting plasmas and then using it for treatment as and when required.
Right, sir. So, sir, I know there's a scarcity of time. You also have a time to stop. So, my last question to you would be that being the health minister of the largest state of the country, so what are the two messages you'd like to give to other states and other people with respect to any big thing which you thought would be good and it didn't work well for the state or for COVID management, any specific thing or one or two things, and one of the best learnings from your COVID management, sir, which other states can also adopt?
See, Corona virus, COVID-19 is a virus which was new to everybody in the entire world. On one hand, you see the Western countries like America and Great Britain or whatever, all these countries who are very highly, they had very sophisticated medical machines and all that, much more advanced than India. They went through the whole thing. When it came into India, with whatever our resources and whatever our infrastructure, we all developed our own strategies. And more or less, the strategies are same in each and every state. Plus, minus, maybe somewhere here, somebody's done a little different. But otherwise, we've all managed our own strategies and tried to contain this virus to the minimum as much as possible. So I would like to say it also opened the eyes to the health infrastructure. As far as I'm concerned, it's opened a lot of, it's opened my eyes on the health infrastructure which is required to be doing now in this Corona time. That we should now start thinking of improving our health services in a very big way. What has actually happened is the government of India or the government, whichever government it is, we've not been giving enough budgetary allocation for the health sector, which I've been saying for a long time, ever since I've come now, ever since I've been come now for 1 year. I've interacted with the health minister in the center also. And I said, when the time comes, I said, now we have to think in terms of developing our infrastructure, medical facilities to the maximum. I wouldn't say that we must build more hospitals and all that, but what we have today is more than enough for our population if we can manage it by getting more doctors, by getting more equipment, by making making it as good as the private hospital, because today the private hospitals have 70% patients go to the private hospital, 30% come to the government facilities. So now we must improve our facilities now. That is given it's a big eye opener for us. And this corona crisis has also made us realize how we can use our doctors, how much they can work, and how we can do when you have a good team. When you have a good team, you have a good strategy, and you can ensure that everything takes place properly. You can systemize the system also in such a way that that the moment you identify a patient, within 72 hours, you must have a system in which the contact can be traced, the chain should be broken, and then likewise you start off with the other side where you put the patient into hospital or you put them into home isolation. That system generates on its own. Like whatever we've done, our technology is only at the directorate level where we monitor it through our computers, through our central monitoring system, where we collect our data from all over the state and then we put them together and then we take it out. So I would definitely say that this is an eye opener for UP, at least for us also. And so we've learned a lot of things from this coronavirus, and till it finishes, then we just have to keep improving our strategies from time to time, ensuring that our teams which are there in the field are given good rest also, given a little bit of leave also, because they are working round the clock. I realize that also because we are pushing them so much for testing, we are pushing them for contact tracing, and they are humans. So they need a little bit of rest. So getting teams which can substitute for different teams at from time to time, and just ensuring the public through messages, through advertisement, that they must wear a mask whenever they go out. If required, if you don't need to go out, then you should go out as less as possible. You have to change your lifestyle now. It is not the same as what we had earlier. So you must wear a mask. You must keep a distance from other people. You must ensure that if somebody is not well, who's coughing and got symptoms, you should stay away from them, and ensure that you only go out when required. So this is, as I told you earlier, this is a big thing for us. Virus is a virus. We'll be tackling it as along with the whole country. But definitely, it has a lot of good points coming in the sense that how I can improve the health services in this state to give better services to the people.
Since you're interacting regularly with the health ministry, central government, so do you foresee any change with respect to budget allotment or increase in the budget for the health in the state? Like your supplementary PIP is going to come now. So do you foresee or you have asked for more budget for infrastructure?
No, at the moment, so whatever budgetary allocation in the state is given to us, that is on its own. That was already decided earlier. Yes. But the center, I think if you had heard the Prime Minister's speech on the 15th August from the Red Fort, he had also implied of spending a little more on health facilities on 3-4 sectors. He had mentioned certain things where I think he's now thinking of allocating more funds. In this corona period, we got a lot of help, financial help from the center also, like all states must have got. So we also managed to get a lot of help on that. But a good thing has come out from that we are going to be developing labs in every district of ours. We will have RT-PCR labs, of course, which is going to be in every district and every medical college. And also we're going to have different machines for vector-borne diseases with a good amount of beds along with that, so that we are eventually prepared for any sort of viruses which come in. For that, we're going to have new trainings, we're going to have equipment, we're going to have buildings for that. So next, whenever something like this comes up, we never know in this world whatever can happen. We should be totally prepared, and our system should be absolutely good enough to handle these sort of situations when it comes.
So any specific planning with respect to vaccination delivery in your state, sir? Because now everybody is gearing up for the vaccine to come maybe in end of December or sometime.
This is something which I don't think I can give an answer to that, because this is already being, there are companies which are already doing a research all over the world, and as far as India is concerned, we keep hearing reports, because whatever reports we get is from the ICMR or from the health department, the central health department.
So my question is, sir, with respect to the reach of vaccination to various corners of the state, sir. Any?
You're talking vaccination of our programs?
COVID vaccination, when it is going to come, when it's formally going to come. So
no, when it comes and when we get allocated, whatever amount is going to be allocated in India to each and every state. So UP has, since we already have a system which is there in place now, it was there earlier, it has become better. With those same teams, we can go reach down right to the lowest villager, right down to the village level or to a town or to a ward. And whenever the vaccine comes, we can ensure that they are given to it according to the direction of the ICMR. Straight away we can give it because our system is there now.
Right, sir. And so one last question, sir, which is very close to our heart because we are from the healthcare industry, is with respect to safety of the frontline workers and mainly the doctors and the nurses, because they have suffered a lot, sir. There are hundreds of, even I was reading in UP, there are hundreds of doctors who have succumbed to COVID, nurses who have been affected. So any improvement with respect to the safety, PPE kits and distribution in various hospitals of the state, sir? Any specific plan for that?
No, that we'd already decided earlier. That was about almost 2 months or 3 months ago when we were already after the lockdown. We already started buying PPE kits, gloves, and triple layered masks and things like that, whatever, sanitizers. All that we started, I think, at least 3 months ago. And every district hospital is equipped with that. We have COVID help desks in each and every department of ours, leave alone the medical line. But in every department, there are COVID help desks with infrared thermometers, oximeters, district level, village level frontline workers are given PPE kits. Everybody has got protective gear now. So we don't have a problem as far as that. And then, as you know, that the coronavirus has a cycle of about 14 days or 15 days. So whenever they are in a L1 facility or L2 facility, our doctors and our staff which are there, after 14 days, there's a rotation. They go back into a quarantine area where they recover after 14, 15 days, and then they're given another duty also. So everybody is given all sorts of protective gear which is available in the country today. We ensure their safety, we ensure their food, their quarters, everything is given. Priority to all our frontline doctors, to everybody. And but we do have, it's unfortunate that some places we've had casualties and certain doctors have died due to different ailments also. We had some senior additional CMOs also, 2 of them which died because they already had a different problem with them. Somebody had a kidney problem, somebody had a brain stroke. So those are there. It has come along with this. So when they contract corona, it becomes worse also. But despite that, we've ensured that every doctor and staff and paramedical is safely provided with protective suits. And the safety is our primary concern.
So over to you, Shankar sir, if you can have the last question and we can conclude because sir has a hard stop.
Yeah, this is actually it's quite a brilliant the way UP fought COVID virus and contained it was quite good. And I think if I am right, when the vaccine comes, probably Team 11 will take over and see that there is a proper distribution. Am I right, Dr.?
Yes, absolutely. Team 11 and our medical teams are already there in place. They are right round daily going to houses, to villages, everything. They're still doing all because we have, as I told you, we have a vector-borne disease programs, different things, which we're already doing that. We're doing immunization in there. Our field workers going almost every day into a house or into a village to ensure that all these programs are being run properly.
Yeah, so when a COVID vaccine comes, you will have no problem because your team is already in place.
Yeah. So we won't have a problem at all.
You were speaking of Red Fort and the Prime Minister's speech. I think the health card was a brilliant idea. Has UP started anything on that? A thought process on that?
On the
Prime Minister announced that he will have a health card for the nation. Has UP started any thought on that process? It's a good idea to have a health card.
No, we haven't started that because whatever guidelines will come from the center, then we'll start on it. But at the moment, we are only ensuring what Ayushman Bharat card, which is already there. 1 crore 20 lakh families have to be given in UP, out of which we've completed, finally identifying them and completed and given them the card, out of which 1 crore people have already got the card and using it for their benefit. And a lot of hospitals are attached to that. As you know, the system, a lot of hospitals are attached. And government hospitals as well as private hospitals, there are a lot of Ayushman card holders are benefiting from that also.
Thank you very much for your time, Mr. Saab. I think you spent a lot of time with us, and
thank you very much.
On behalf of Heal Foundation, we congratulate you on the wonderful work that you have done in Uttar Pradesh. In fact, I should tell you that when COVID started, first people had 2 places to look after. One is Mumbai, another was Uttar Pradesh. They said the virus will explode in these 2 places. Of course,
Exactly.
in Mumbai it exploded, but in UP it didn't explode thanks to your initiative and team level that you took place. I think that was a brilliant way to contain the virus. And I think the work will continue in this. Yes, Sudeep, you wanted to say something?
Thank you, sir. Thank you. Thank you very much, sir.
Thank you,
very
Pradeep.
much.
Thank you very much for allowing me to join into your webinar and meeting.
Thank you.
Very
Talking
useful.
to Dr. Shankar, Mr. Shankar, very useful. Thank you.
Thank you. Thank you.
Thank you.
Yeah, thank you. Ankit, if you can do a word of thanks and play the video, and we can. Shankar sir, any other point? I think the overall discussion synopsis.
No, it was, yeah, it is good, no problem. Yeah, everything was covered. I think UP has done quite well.
Yeah, quite well. No.
Well, thank you everyone who joined us today. And with the promise that we will come with another good topic in our next Healthy Samvad, we will say goodbye for the day. And we will leave you with the video of our past 150 days of the work.
Myself, Dr. Pradeep Srivastav. I am a public health expert. I represent the HEAL Foundation, a healthcare advocacy group in India. And today's objective is I wanted to introduce to you a very unique program called Heal Die Samvad. You can even call it Healthy Samvad or Heal Die Samvad, which is being introduced by us brought to on our platform by Heal Foundation in association with an international public health program, ICCIDD.
धन्यवाद के लिए मैं आप लोगों को धन्यवाद देता हूँ हिल फाउंडेशन की टीम में. The speakers that you brought are तारे आसमान से जमीन पे ले आए आप सारे सितारे थे. Excellent panel of speakers. Excellent. Best you can think of. My concluding message would be number one, that the entire world is your family. As our ancient scriptures have said, Vasudeva Kutumbakam. Why? Because this virus does not discriminate between any color, caste, creed, country, age or gender. हम सब एक लोग हैं, एक कुटुंब है हमारा. So we have to face this pandemic with a human face, expressing sympathy, empathy and compassion.
संकट काल में, पेंडेमिक के इस काल में कि जब पूरी धरती पर भय, असुरक्षा और एक प्रकार का अवसाद है, ऐसे काल में आपने एक संवाद का अवसर दिया है. हमारे शास्त्र कहते हैं कि वादे वादे जायते तत्वबोध. जब कभी व्यथा हो, अवसाद हो, चिंता हो, अल्पता और विशेषकर कोई रोग हो या मानसिक क्लेश हो या किसी भी प्रकार की मनुष्य के सामने चुनौती हो, तब वो संवाद करें.
Sometimes it can be a relief also that you don't have to get up and wear your best clothes and be out and about. That can also be relaxing for the first couple of days where you can just be. But after some time, I do feel when such an extended lockdown happens, in order for you to feel a little boost to your own self-esteem, for you to do something in the day, there's nothing wrong in wearing clothes that you would go out in, putting on a little makeup, doing your hair.
Foundation has been doing considerable work. It's about 10 years old now. And we have been organizing a lot of health writers workshop, and main focus is on training health writers to report accurately on health issues and current health issues, and not be carried away by sensationalizing things as many of the media do, especially after the onset.
From him by Jordan, his best chance to win it. It was Barkley, who does not rotate on defense,